Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to the folks in our community who have asked questions and reached out to us, the Board of Health, and elected officials to learn more about COVID-19. While it isn't possible for us to respond to every question or email we receive, we want you to know that we hear you and value your commitment to learning more about this virus in an effort to increase your understanding and lessen the blow of misinformation. So thank you. That said, we do want to begin this briefing talking about a few topics that we have recently been receiving questions about. The first is testing. The PCR test, which stands for polymerase chain reaction, is known as the gold standard for COVID-19 tests. These tests are used across the country and the world. Of course, every medical test has its limitations. However, the PCR test continues to be touted by medical experts across the world as the most reliable test on the market for diagnosing COVID-19. Another topic we continue to receive questions about are the isolation and quarantine guidelines. These guidelines are not Knox County Health Department guidelines. They are coming from the state and federal level and are based on how the virus operates. Essentially, they are based on the rules of the virus itself. Current research shows the incubation period for COVID-19 is thought to be 2 to 14 days. That means that someone who is exposed to COVID-19 can become a positive case themselves anywhere from 2 to 14 days after their exposure. Conversely, we isolate individuals who are a confirmed case for at least 10 days, which is the known infectious period, or how long the research right now indicates that you can spread the virus. These guidelines are continuing to be evaluated daily from researchers across the world. And if new research leads to changes in these guidelines, we will make adjustments here locally. Even though it's hard to remember a time before COVID-19, it's important to remember that this virus is still a new virus, and we anticipate more research to be conducted over the coming months and even years. We know it can be frustrating to receive a call telling you that you need to quarantine, but it is still the best tool that we have to prevent the further spread of this virus. As a reminder, close contacts are defined by CDC and the Tennessee Department of Health as being less than 6 feet away from an infectious individual for more than 15 minutes over a 24-hour period. Abiding by the 5 core actions, especially the physical distancing component, remains the best way to avoid being quarantined. We will now move into the local situation. We have 152 new confirmed cases since yesterday's report, giving us 14,800 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 792 probable cases. 13,821 of our cases are considered inactive, giving us 1,646 active cases. 513 individuals have been hospitalized at some point in their illness, and 75 Knox County residents are currently hospitalized. Unfortunately, we have no additional deaths to report today, keeping our total at 125. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. All of the data we're going to talk about today is on our website. You can find it at knoxcountytn.gov/case-count. Moving to the first benchmark. Sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and growth rate over time. Over this time period, we experienced 7 red flags, with 3 consecutive red flags occurring over the most recent 3 days. During this time period, we saw an average of 156 new cases per day over the past 7 days, and 137 new cases per day over the past 14 days. Because of these factors, we are representing this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we're utilizing 2 bar graphs. one that shows a sample of the test conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, there were 7 red flags and 1 yellow flag during this time period. On 2 occasions, these flags occurred on 3 consecutive days. Regarding lab turnaround time, there were 8 red flags and 1 yellow flag noted in this time period, all of which occurred on consecutive days. Because of these factors, we are representing this benchmark as red. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in this time frame. And because of this, our benchmark continues to be represented as green. As a note, as the volume of new cases increases, this benchmark does present more of a challenge, and we are looking at options to best address this. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS, and it may reflect Knox County, the East Region, or patients from other jurisdictions. During this time period, there were 3 red flags and 1 yellow flag detected for the number of inpatients with COVID-19. However, they were not on consecutive days. Additionally, there were 4 consecutive days with red flags for COVID-19 patients in the ICU. 2 red flags were detected for the number of COVID patients on ventilators. After speaking with our hospital partners, they've recommended that the benchmark remain a stable yellow. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan the response together to best serve the community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. Over this period, we have seen 18 deaths related to COVID-19, 10 of which have occurred in the most recent 7 days. This information available leads us to represent this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID-19 cases per 100,000 population. As of Tuesday, our 14-day trend line shows 29 new cases per 100,000, and our 7-day trend line shows 33 new cases per 100,000. The second chart shows the percent positive for COVID-19. The data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 14.36%. And I now open it up for questions.
All right, please go ahead and put your questions into the chat feature. The first question we have is from Jeff with WATE. The new White House task force report puts Knox County back in the red zone after going back down into the orange zone. Is this just a phenomenon of the virus ebbing and flowing, or are we doing something wrong as a community?
It's hard to tell from week to week data. We tend to try to look at trends there, but we can say that from the current trends that we're seeing in our data that I think Dr. Buchanan said this on Tuesday in the Board of Health meeting, that it's going in the wrong direction. And so we are concerned about that. Again, a lot of it that we see and we hear from cases is really the getting comfortable with people that you're around a lot, whether it's your office mates or your friends, and letting your guard down and not following the 5 core actions in those settings, and not being separated, not wearing your mask in those settings. And so we really want to encourage that people continue to follow those 5 core actions all the time, even when it feels awkward, to make sure that we can limit the spread of the disease.
From Annie with WBIR, we saw 16 deaths in a week, the highest since the pandemic began. Can you speak to that at all? And do you have any demographic information you can share?
I believe the information, most of it's on the website of the breakdown of what we're seeing. It does continue to be in the older demographic. I think one of our deaths was in the 50 to 60 age range, which is a little bit younger than we have been trending. But again, it's concerning. And we've said this many times, as case rates go up, hospitalizations go up, and then unfortunately deaths go up from there. And so it plays a role. So if you're a young, healthy person that feels like you're not going to be impacted by this virus much, that might be true, and hopefully it is, but it doesn't mean that you're not coming in contact with people that can have really serious consequences. And that's really what all of these recommendations are about, is trying to protect and prevent those serious consequences.
And Annie, secondary question was, do we expect this trend to continue with the high hospitalization numbers?
I think it likely will, and hopefully we can get a downturn in our case rates and our hospitalizations and have an impact on that in the near future. But if we can continue down the path we've been on, I think we will continue to see this.
From Vincent with the Sentinel, what is the exact schedule for health department testing for now through Thanksgiving?
We will have to get that to you, Vincent. It's 9 to 3 every day between now and Thanksgiving, and then Thanksgiving week there might be a little bit of an adjustment, and we'll get that. It's Monday through Friday, and then we'll get the details for Thanksgiving week out to you as soon as possible.
And we'll also make that available on our website as well. Vincent's secondary question was, what time of day is the least busy to get a test at the health department, and how busy do you expect it to be in the days leading up to the holidays?
I'm looking around the room because I don't get down to the testing area much, so we'll have to follow up with you on that and get the answer, because the folks in the room that do testing the folks in the room don't do the testing piece. So we'll have to get back to you on that. We tend to see a little bit of an increase a week or two before holidays, and then it tends to drop off right before the holidays. So that's kind of been the trend of what we've seen. But hopefully people will continue to get tested and, again, follow the guidelines and stay home and isolate and quarantine as appropriate if they do get tested and find out results.
From Megan with WVLT, has the health department been given a timeline for when the vaccine will be distributed in our area?
We don't have a firm timeline yet. We've been told to be ready by the end of essentially this month and be ready to go from it. But at this point, we don't have any more knowledge than that of when we may receive vaccine.
From Jeff with WATE, the number of positive inpatients is higher than it has ever been. The benchmark is still yellow. The explanation on that benchmark decision is that it is made in concert with hospitals. Can you explain more about this discussion?
I think that's a really good question for the hospitals. They did talk about it on Tuesday a little bit, that they are still able to meet the demands of the hospitalizations and patients' needs at this time. And so that's where we were informed that they would be staying yellow at this point. Any more details, again, I would refer to the hospitals on that.
Jeff's other question was, does KCHD disagree at all with the hospital's take on this point?
That's really up to the hospitals who understand their operations and what their resources are to meet the needs. And so we trust them as valued partners, and will continue to do so when they give us the recommendations for where they stand.
From Vincent with the Sentinel, if people want to get a test before traveling for Thanksgiving, when should they have one done to get results back in time?
Well, our results are taking a bit longer, and I think across the community they are as well. And so there's a couple of pieces to this. So you definitely want to get tested, and our test results take 3 to 4 days typically to come back now, and I think that's close to where our trend is across the community. But the other thing for people to know, and it's a good idea if you want to get tested, but it's only a point in time. So just because you were negative today, we need people to know that that doesn't mean that they wouldn't become positive the next day or the day after that. And so again, whether you've been tested or not, those 5 core actions, we can't hit that home enough. We have to follow those to keep from spreading this, especially over the holidays when there'll be travel and all of the family gatherings and things that go along with that.
From Annie with WBIR, state lawmakers have already filed a bill intended to take power from the Board of Health and give it to the mayor. What is your take on that?
I think we've said before many times that we will go along with what that is and make recommendations to the appropriate authorities that have the decision-making abilities as granted by state law. And so if we have to shift that direction to the mayor, we'll do that from the Board of Health, but we'll continue playing our role of advising and providing our expertise and recommendations to whoever is making the decisions.
From Jeff with WATE, if people are traveling for the holidays, should they take specific things to keep themselves safe using public facilities like gas stations, restaurants, and restrooms?
Well, take your mask first and foremost. Hand sanitizer. I always travel with hand sanitizer, so you can make sure that that you can sanitize your hands frequently, and then just doing all of the 5 core actions all the time. And so disinfecting surfaces and those types of things are also always helpful. But really, if you're washing your hands before and after you commonly touch surfaces, and you're wearing your mask and you're keeping your distance from people, you should be good. But again, follow those 5 core actions all the time.
Vincent with the Sentinel, he says his question goes hand in hand with the previous question you just asked or answered. What should people who have tested negative do to ensure they don't become infected between the test result and seeing their loved ones?
Yeah, I mean, again, that test result also is, we cannot stress enough, that's a point in time. And so continue to follow those 5 core actions. If you become symptomatic in the least bit that you can have any symptoms at all, then you need to avoid seeing your loved ones as well. That'll help prevent the spread of disease. It's one of those 5 core actions. And then just try to limit your exposure in general leading up to travel. So, of those 2 weeks leading up to when you're going to go see family members, which is pretty much now, if you're going to travel for Thanksgiving, limit your exposures as much as possible. Don't go out with friends in between now and then, or have dinner parties at your house and those types of things. Make sure you're following those 5 core actions at work all the time. All of those things will help to limit transmission.
From Annie with WBIR, how do you suggest people combat the fatigue that we all feel, especially during the holidays?
Are we talking COVID fatigue or holiday fatigue? I think that is going to be challenging this time of year. It's a stressful time of year anyway, right? With all of the things that come along with the holidays and family gatherings and parties and meeting all the expectations that are there. And so we really encourage people to be mindful of their health. We want you to tune out of the news and try to step away so your mental health can be protected as much as possible. Get some exercise, be outside, get some fresh air as much as you can. All of those things to help your mental and physical health leading into this season is always important. Make sure you're getting enough sleep. All of those things are important to do during this time. And with the added stress of COVID-19, they're just as important, if not more, as they are every other year.
From Vincent with, sorry, I skipped one. Jeff with WATE, you mentioned a moment ago that benchmark 3 public health system capability might require more resources in the future. Can you elaborate? Is there a staffing or funding issue?
It's not really a staffing or funding issue. I mean, there's lots of challenges that come along with it. And so we have opportunities we've talked about before with working with the state to help with some of our investigations. And we may be moving back to that. We're discussing that and what that's going to look like. And some other opportunities as far as other ways to get interviews complete and informations to people through surveys and things of that nature. And so we're looking into all of those to really allow our staff to hone in on the response, and then also free up other staff to go back to doing the rest of their work as well.
From Vincent with the Sentinel, you and other public health officials have said that testing is merely a snapshot in time and that there's a high risk of false negatives. How highly should people weigh negative test results prior to holiday travel?
And I wouldn't even probably call it a false negative. I think you might just not be positive yet. So again, keep in mind there's that 2 to 14 day window, and you can become positive at any time during that window from your exposure. And as much disease as we have circulating in the community right now, there's a lot of opportunity for exposure that you may not even realize or recognize. And so there is risk there. That's why we're talking about it. If you can limit your travels, if you can stay in smaller groups for the holidays, all of the things, I haven't been asked yet, but I'll just say it out loud. I mean, I'm having Thanksgiving, I usually travel, but we're having it here with our nuclear family, and we're going to be doing more over, FaceTime and Zoom and that type of thing, so that we can still connect with our family, but avoid the high risk travel that comes along with that. I think also, which the other thing we haven't talked about is really having those conversations with family members, if you are going to be traveling, to know what their activities have been and what type of precautions they've been taking, and having those hard conversations sometimes about making sure that all the guidelines are being followed to keep them safe and you safe as well.
From Jeff with WATE, the White House Task Force recommends for red zone communities, quote, proactive weekly testing of groups from the community, teachers, community college students, county workers, staff in crowded or congregate settings, all hospital personnel, large private sector employers, end quote. Is that feasible or part of our plan in Knox County?
There are definitely challenges that go with that. Just that volume of testing, while it's ideal, is challenging. I mean, we've seen volume of testing over the recent few days go up, and testing turnaround times go down. And so the labs have to be able to match that same capacity to put through and actually run all of the labs and get the test results back. And so it's being done in a lot of places, and currently in congregate care settings and in different settings in the community. And we encourage people to continue to seek out testing, especially if you've been exposed or you're symptomatic. But those additional settings for all county or red employees and that type of recommendation, we're not looking at right now at this time. Just logistically, it's very, very challenging.
Jeff with WATE, are outdoor tents we've seen around town for restaurant dining more safe than indoor options? If so, why?
Well, it kind of depends probably on how the tent's set up. So if there's really good ventilation and air circulation in the tents, then they probably are. There's a lot of evidence to suggest that ventilation and air circulation helps to disperse the virus. If they're enclosed like an indoor building, then probably not any safer. And so again, recommend that people really look into those things and think about them. And going out to eat with your family unit is one thing, or going out to a restaurant or something along those lines versus going out and with people outside of your family unit. So we still recommend when you're outside of that family unit that you follow those 5 core actions. And if you can't do it, reconsider how you're doing it in a different way where you can.
From Vincent with the Sentinel, what to your knowledge is constraining the local lab turnaround time?
Lab throughput. So we actually have spoken to our lab that we're working with right now, and it's really a sheer volume issue for them at the lab for their throughput. So it's not, we're not aware of any logistical problems with their resources to do the testing, or our ability to do testing, or the testing in the community. It's actually that. So I would recommend that you ask the labs if you want more information on that.
All right, any further questions, please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for your time, and we will talk with you again at our media briefing on Tuesday of next week. Have a good and safe rest of your day and a good weekend.